My dear brothers and sisters of Sri Balaji Vidyapith and the School of Yoga Therapy, Institute of Salutogenesis and Complementary Medicine. Good morning, India, and good evening, America. This is Dr. Dilip Sarkar from Washington, D.C., United States of America. It's an honor and privilege to be invited by the Institute of Salutogenesis and Complementary Medicine for their program, Yoga Therapy in Healthcare and Educational Settings. My presentation will be on integrating yoga therapy with the modern healthcare system and American experience. Let me share the slides with you now. Okay, here we are. I'm going to restrict my presentation primarily on the state of yoga therapy in America. I've been living in this country almost over 50 years, and I have a lot of assignments. You can see I've been a president of the International Association of Yoga Therapists for for 5 years and for a long, long time. And we're going to show it to you how we are introducing yoga therapy in our healthcare system. This is a beautiful slide I received from one of my friends. It's a Western trained physician sitting in a Padmasana. Our American healthcare system is the most regulated healthcare system in the whole world. But on the other hand, given proper data, number, research, and the therapeutic outcome, it is the most liberal healthcare system to accept all the new modalities, including the yoga therapy. We'll present to you chronologically how slowly yoga therapy got integrated with the American healthcare system and what we have done to introduce the holistic yoga philosophy, the Yoga Sutra of Patanjali, and the 8-limb practice, Patanjali Ashtanga Yoga, in the healthcare system, instead of the reductionist practice of yoga asana only. And you'll see we'll go step by step. Yoga was first brought to America by Swami Vivekananda, and he came here for the lecture at the Parliament of World Religion on September 11, 1893. And we always mention that it was 108 years before the 9/11 of United States. He coined the term best of the East and best of the West, and he spread the spiritual part of yoga. Subsequently, a lot of people brought the yoga in United States. The next one was a Paramahansa Yogananda, the author of the autobiography on yogi, Maharishi Mahesh Yogi, who started the transcendental meditation, and he has a big whole city now. It's called Vedic City in the state of Iowa. Swami Rama established Himalayan Institute, Swami Satchitananda Yogaville, Swami Kripalu, the Kripalu Center for Yoga and Health, which is the largest yoga center in this country. Swami Sivanand Saraswati for Sivananda Ashram, Baba Haridas in the Mount Madonna Center. It was first Dr. Herbert Benson, the physician from the Harvard University of Mass General Hospital. He was a follower of transcendental meditation, and he noticed the physiological changes of the yoga practice. He measured all the physiological practices, and he wrote the book called The Relaxation Response. Immediately, it became one of the bestseller, and when you read the book, you will see he represented the relaxation response, what we call a meditation. The coming down of the mind, removing the repeat thought process, and increasing the gap between the thoughts. Probably at that time, he was hesitant to use the term meditation, but it was purely what we call meditation is the medication. He's still there on his name, the best hospital in this country, Massachusetts General Hospital, has an institute called Benson Henry Institute to introduce yoga in the healthcare system. Subsequently, a lot of physicians and who are your television personnel introduced yoga, but primarily they are a reductionist in the yoga asana format. One of them was Dr. Mehmet Oz. He was a cardiothoracic surgeon, and he understood yoga and Ayurveda very well. And he had a big time a television show of which he was introducing yoga. This was another TV personnel, Oprah Winfrey, and Dr. Oz was showing Oprah Winfrey how to use a neti pot. He was also interviewed in the Time magazine. Then came our Deepak Chopra. He's the endocrinologist, and he was introducing and improving the health of America through yoga and Ayurveda. He's the person who started introducing what we call the traditional yoga of the philosophy and practice of yoga. We came along at that time, after that, under the leadership of Rajan Narayan of the Life in Yoga Institute, and with a presenter, Satbir Khalsa, who is a researcher in the Harvard University and who will be one of your presenter, and myself. We started the first ACCME called Accreditation Council for Continuing Medical Education approved Category 1 Continuing Medical Education course for yoga therapy for physicians and healthcare providers. It is extremely, extremely difficult to get the Category 1 CME recommendation or recognition for the physicians. On the other hand, physicians are not going to a conference unless they get the credit which they use for their recertification and your application for their licensing. It was in 2010 through Howard University, and it was Dr. Arvind Nandekar who helped us to get your Category 1 recognition. We continued the tradition twice a year in person and different locations initially, but essentially ended up in a location next to a Baltimore, Washington International Airport. It was very beautiful setup, and the faculty was myself, Dr. Dilip Sarkar, Satbir Khalsa, and Rajan Narayan. You have to submit all of our credentials, all of our slides, all of our presentations to get the CME recognition. Finally, we became very popular in the physician community, and Life in Yoga Institute applied to Accreditation Council for Continuing Medical Education to be the provider of the Category 1 continuing medical education. It was an extensive process, 300-page application, multiple interviews, but with our persistence of providing that a traditional yoga to present the philosophy like Yoga Sutra of Patanjali and the practice of Patanjali Ashtanga Yoga in the yoga therapy. And finally, we succeeded in 2014. And as you can see, ACCME approved that Life in Yoga Institute to be the provider of the Category 1 continuing medical education course, which was the first in the United States of America. We have a lot of physicians who came to our program and they got certified, and they were very happy with what we were teaching. And all the physicians then asked me that, why don't you put all of them for the physician in a book format? So I wrote the book, Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence. This was primarily for the physicians and the healthcare providers, and how to integrate yoga therapy with the modern healthcare system. Here is the sketch in front of my book of Albert Einstein and Rabindranath Tagore, to sketch by my wife, Shikha Sarkar, who is an artist, and it shows that a scientist and a philosopher, and we mentioned to our physician friends that when the science meets the philosophy, it's 21st century medicine. The book has all the references for the physicians. It has references of 25 books from the physicians. It has a website from all the medical centers, and it has 75 articles from the established medical journal, which our physician uses for daily practice, like Annals of Internal Medicine, Archives of Internal Medicine, Journal of American Heart Association, New England Journal of Medicine, and I'll show you more and more. I'm not going through the papers, but I'll show you how many yoga therapy articles been published in United States. This is our recent book for the physicians, for the healthcare providers, The Principle and Practice of Yoga in Cardiovascular Medicine. There is about 75 writers and experts. And I also wrote one chapter, which is the daily routine, the dinocharya, to improve the dinocharya as a prevention for the cardiovascular disease. These are the few other books written by the physicians. My friend Timothy McCall wrote Yoga as a Medicine. Our friend Larry Payne wrote Yoga Therapy and Integrative Medicine. Larry Payne is very well known to your institute. And I wrote the little foreword and little blurb with Dean Ornish. So Dean Ornish and myself wrote the praise for the book. The latest book, The Principle and Practice of Yoga in Healthcare, with Sadbir Khalsa, Lorenzo Cohen, Timothy McCall, and Shirley Tallis, put together primarily for the physician and the healthcare providers. Yoga therapy slowly became part of our new branch of medicine called integrative medicine. Integrative medicine means the integration of the wisdom of the traditional system of healing with the science of the modern medicine. 20 years back, hardly any medical school has a department of integrative medicine. Now almost 100 schools have it, 65 have a program, 25 have a training program, and they have established in 2014 the American Board of Integrative Medicine to be board certified. What is the board certification means in the United States? That means you developed a credential now to be a super specialist or subspecialist to practice, and integrative medicine became a subspecialty of internal medicine. The integrative medicine fellowship was monitored by the American Board of Physician Specialists. In 2020, the Academic Consortium for Integrative Medicine and Health assumed the role of recognizing integrative medicine fellowship, and the accreditation became very strict. Today, in 2023, we only have 18 active and 4 inactive programs of integrative medicine fellowship. This is the website for the American Board of Physician Specialists. You can go and see the integrative medicine, the eligibility, application, and the exam process. It is a very strict process to be certified by Board of Integrative Medicine. What was interesting, the seismic shift in American healthcare system is the Academic Consortium for Integrative Medicine and Health in USA developed the definition of integrative medicine, which reaffirms the importance of the relationship between practitioner and patient, focuses on the whole person, and looking beyond the body and mind to achieve optimal health and healing. The whole Western medicine or modern medicine in the United States was totally on the physician-based. Integrative medicine is totally on the patient-based. Patient is in the center. Patient is the true physicians taking care of themselves. So with this shift in the Western healthcare system, we started teaching the physicians the traditional yoga. And let me go over with you next few minutes what we teach. Most of you know what exactly I'm going to show it to you, but this is the shift from the yoga asana based the healthcare versus the whole yogic philosophy and practice in yoga therapy. I tell them it is not yoga, it is yoga. It's a Sanskrit word, union of body, mind, and spirit, union of Jivatma and Paramatma, and it is a text by Patanjali. Said there is a philosophy called Yoga Sutra of Patanjali and the practice Patanjali Ashtanga Yoga, and it was designed for self-realization, and the health benefits are byproducts which you use as a adjuvant therapy for chronic lifestyle-related disorders. Describe our existence as a body, mind, and spirit. Body is a hardware, mind is a software, spirit is a programmer. And I am the programmer. I control my software, so I control my hardware. We teach the Yoga Sutra of Patanjali's in the 4 chapters and go by chapter and emphasize more on your sutra, sthiram, sukham, asanam in the asana practice. We teach them Patanjali Ashtanga Yoga practice, go through yam, niyam, asana. Asana, we tell them It is a posture, external, internal alignment. Pranayama, control and restraint of prana. It's a voluntary regulated breathing. Pratyahara, withdrawal and control of senses. Dharana is a focus. Dhyan is a meditation, controlling the repeat thought process. And samadhi is the union of the body, mind, and spirit. We totally discard the term yoga and meditation, which is commonly used in West and also even in India. I see it quite often. We tell them the meditation dhyan is a seventh limb of yoga, and the meditation is a part of yoga. In the yoga teachers training, we teach them how to do the perfect yoga practices, including the asanas, pranayamas, meditation, or all the 8 limbs. But in yoga therapy, it's an adaptation of the yoga practices based on the patient's clinical condition. What does it mean? What does it mean that we establish a practice where the patient starts? Some of the patients who come, who can just only sit down in a chair, cannot even turn, cannot even breathe, also comes with the oxygen supplement. We teach them slowly a asana called sthiram sukham asana. Relaxation response, activation of parasympathetic tone. Teach them the pranayama, voluntary regulated breathing, but is purely effortless. They do the pranayama as if it is their normal breathing, and when they continue the practice, a neuroplasticity sets in, and slowly the time gets more and more, and they become more proficient in it. We teach them in stages. Impossible become possible. Inhalation is sympathetic, exhalation is parasympathetic. Teach them how to do a longer exhalation than inhalation. So the meditation, we call this the meditation is a medication, and that is a mechanism of action of the yoga therapy. And difference between a meditation and medication, we said there is only one T is here, and in medication there is C. T stands for your transformation, and medication C stands for your choice. We also teach them that father of our modern medicine, the Hippocrates, has said it is more important to know what sort of person has a disease than to know what sort of disease a person has. We teach the yoga therapy totally on the base of the holistic, the whole approach, rather than that not interested about the disease a person has. We teach them, even when you're doing a Paschim Namaskar, like putting a prayer pose to the back, if you can relax the upper part of the body, rest of the body gets relaxed. Your hip gets relaxed, knee gets relaxed. It is a total holistic. Holistic means we teach them that is a whole. We don't put the W in front, that becomes a word holistic. It is a relaxation response, an activation of parasympathetic tone. And all the physicians will come and ask, I'm exercising, why do I need to do yoga to incorporate in my practice? Exercise is a sympathetic overdrive. Heart rate goes up, blood pressure goes up, respiratory rate goes up. When there is a sympathetic overdrive, body starts the homeostasis, it starts the activating parasympathetic tone. So the heart rate comes down. So when you stop the exercise, you see how quickly your heart rate comes down, which is the shifting from sympathetic to parasympathetic response. In a practice of yoga and yoga therapy, it is a primary activation of parasympathetic tone without having the sympathetic overdrive. Why? During the sympathetic overdrive, a lot of crisis and catastrophe happens. It is the introspection, looking inside yourself. We say self-realization. Self-realization means develop real eyes. The eyes turn backwards. Now you started looking inside you other than looking outside. There is no problem in the world which does not have a solution. And there is no disease in the world which does not have a cure. Just awaken the doctor within. And we also say, how do you spell the disease? Dis-ease. So we say the treatment of dis-ease is called a effortless ease, which is a yoga practice. We must make our body work for us. Nothing has the greatest power to heal but self. The whole health is the art of self-healing. Yoga therapy provides the first, roger chikitsa, treatment of a disease, then shastarokha, maintenance of health. These maintenance of the health become preventive medicine as your primary prevention, secondary prevention, and tertiary prevention. At the end of the day, we finally, our teaching to all of our yoga therapy patients and the physicians that I am the cause and I am the cure. You have created the lifestyle-related disorders, and you are the only one who will be able to cure. That is called the patient-centered medicine instead of physician-centered medicine. Our Western medicine is an evidence-based medicine, and yoga therapy is a practice-based evidence. Keep practicing. We say, Karo Yog, Raho Nirog. Do yoga, stay disease-free. It's the art of transformation from a rogi, people with disease, to nirogi, people with no disease, to yogi, people with a comfortable life. This is a slide, I got it from our friend, our common friend, Dr. V.M. Hegde. And this is the thing he said, if West does not believe the effect of yoga therapy, and also when West doesn't believe in global warming, this is the sign. It is an experiential, means you are the creator of your destiny. It is a transcendental science. That means a science beyond science. It's a philosophy. That's what we say. We integrated Albert Einstein with Rabindranath Tagore, the philosopher. It is experimental, called personal practice. It is a lifestyle, art and science of healthy living. And we are in a position now to write a prescription on yoga therapy to help with chronic low back pain, metabolic syndrome, cancer, and other lifestyle-related disorders. Dean Ornish, cardiologist in the University of San Francisco, he was trained by Swami Satchidanand in the Yogaville in yoga, and he started a program, Dean Ornish's lifestyle medicine. And he gave the term intensive cardiac rehabilitation to reverse the coronary artery disease. He had extensive research and multiple healthcare system, and almost after 25 years, his program called Intensive Cardiac Rehabilitation is now covered by Medicare. Medicare is the government health insurance for people who are above 65, and also many other private healthcare insurances. So in America today, the medical healthcare insurances started reimbursing with yoga therapy, and now they're looking for your CPT and ICD codes very carefully. So our first teaching is a transformation, not to master the asanas or the posture, that's what we teach, but use the postures or asanas in stages for transformation and therapeutic benefits. Each asana at any state, like you're sitting here, if you can turn a little bit, turn slowly and stay here. Close your eyes, do the hand mudras, breathing out longer than breathing in. And in a short time, you'll see you'll be able to do it a little bit more because neuroplasticity sets in. And slowly you'll be doing, paying attention that there is no pain. Pain means pay attention. So you don't want to go to the state of pain. And effortless breathing, because heart and lung is the same organ. If you put a stress in the heart, it shows up in the lung with the effort in breathing. And if you do effort in breathing, it shows in the heart with the increased heart rate and increased blood pressure. It is the yoga practice that meets you where you are. Very important, meets you where you are. You are not going to do perfecting poses or perfecting asanas or perfecting pranayama. A staged approach that teaches a pain-free asana, effortless pranayama, and meditation to optimize body's natural healing power. It also builds physical and mental resilience. So start from the patient where they're and go in stages, and it's in stages, impossible become possible. That is a Desikachar's very wonderful statement. Yoga therapy relaxation, we teach them that you sit down here, you're sitting down in a Sukhasana, and sit down here with your hand mudras, Dhanu mudra or a Gana mudra, and then you close your eyes, pay attention to your breath, breathing out longer than breathing in, relaxation response sets in, you go back to the next in Siddhasana. From Siddhasana, you can go to Ardha Padmasana, then go to Padmasana. In a Padmasana, it is the wonderful relaxation response. In fact, we teach them this relaxation response is the preventive medicine because the relaxation response is going to work through what is called a psychoneuroendocrinology, and we'll be showing it to you how the relaxation response works. It was Swami Rama who first showed that a yogi practicing this pranayama and activation of parasympathetic tone, they can control their autonomic nervous system. Normally, we can only control our voluntary nervous system that can open and close. We cannot even control our involuntary or autonomic nervous system. He was seen by a physician, Elmer Green, in 1969, and he said he can stop his heart. And he was all connected here, and he started stopping his heart. But he started stopping his heart, he got some atrial flutter, and atrial flutter looks like, then he said, just stop it, don't do it. But in the meantime, what happened, because of peripheral vasodilatation and the reduction in the peripheral resistance, the blood flow in the hand through two arteries, radial and ulnar arteries, increased. This was the first introduction of yogis controlling autonomic nervous system. So what we have taught them in the relaxation response is that it increases the preload of the heart. That means volume of the blood received by the heart during diastole. And it is through effortless pranayama, which increases the negative intrathoracic pressure. So with the relaxation response and activation of parasympathetic tone, the peripheral resistance goes down and the afterload gets decreased. You have an increasing preload, decreasing afterload, and it causes an excellent improvement of the ejection fraction. And there is no medication which can do it for your heart function. The relaxation response physiology is being published one after another in the medical journals, and I will show it to you, the established medical journals who have published all the articles about yoga therapy in the United States. This is the one in the Public Library of Science. This was actually authored by Herbert Benson, the father of yoga therapy in the United States, and showing the relaxation response, which are an expression of genes, which I'll come and show it to you, what it does to your body and mind. It acts like an antioxidant. It controls apoptosis. This is the Bible of medicine in the United States. The New England Journal of Medicine published an article, then Era of Mind-Body Medicine. Herbert Benson was one of the authors. I'm not going through any of these articles, just to show you how the yoga therapy articles being accepted in the established medical journals in the United States. The Journal of American Heart Association, a prime journal. Meditation and cardiovascular risk reduction, a scientific statement from the American Heart Association, 2017. The Journal of the American College of Cardiology, JACC, one of the most prestigious journal with the yoga-based cardiac rehabilitation after acute myocardial infarction, 2020 publication. This is just a few facts about yoga in America, how many people are doing it, and how much money is there. But American believes that yoga relieves stress, good for you, increases flexibility, strength, and performance. Basically, the word is out that yoga therapy is helpful in your chronic lifestyle-related disorders. When you look at the PubMed is the search engine for US National Library, and we put a yoga therapy, you'll say over 7,000 articles, 7,500 articles. They do separate yoga and meditation, which is actually a Western term, but we teach them the meditation is the seventh limb of yoga. But when you put a meditation, you get more articles, over 9,000 articles in PubMed search. So when you looked at the article published, the first sort of published article in established journal, which is the Lancet, 1973, Yoga and the Biofeedback in the Management of Hypertension. In next 2 years, in 75, it's called Randomized Controlled Trial, Yoga and Biofeedback in the Management of Hypertension. We were really wanted to show the physician community how early we start integrating yoga therapy in Western medicine. It's a landmark article by Nagendra and Nagaratnan from SBSA in British Medical Journal, Yoga for Bronchial Asthma. JAMA, the Journal of American Medical Association, another prestigious journal, yoga-based intervention for carpal tunnel syndrome. This was the Annals of Internal Medicine, comparing yoga, exercise, self-care for chronic low back pain by Karen Sherman. And when this was published, she was in every television channel. She was in CNN, ABC, NBC, CBS, all the television channels interview about her, about the yoga therapy in Western medicine or modern medicine. Spine is a very prestigious journal. You have an article in Yoga Therapy for Chronic Low Back Pain. Archives of Internal Medicine, same, a randomized trial of yoga, stretching. See, I'm not showing you the research journal. These are the all clinical journal which the American physician uses in the day-to-day practice. Again, Annals of Internal Medicine about chronic low back pain. This is the JACC, Journal of American College of Cardiology. Their acceptance rate, I have no idea, but it's a very, very extremely low. That means, maybe 1 in 20, 1 in 10. But they got an article published, Yoga Therapy for Atrial Fibrillation. So you can see how it is being accepted slowly and slowly. National Cancer Institute gave a grant for yoga therapy for breast cancer to MD Anderson Hospital to Lorenzo Cohen. And he started, connecting with SVIASA in Bangalore, and they published the paper, Yoga Therapy for Breast Cancer, along with their MD Anderson Hospital and Swami Vivekananda Yoga Anushandhan Sanstha of Bengaluru, India. In the same year, that other article came up, Yoga Therapy for Breast Cancer in the prestigious medical journal, Journal of Clinical Oncology. Another one, Archives of Internal Medicine, more doctors are prescribing yoga for their patients. University of Virginia, it's very prestigious and maybe one of the top, number one. The state-sponsored university, they started a program, Foundation of Medical Yoga for Health Professional, and I was the one of the advisors to start the program and was teaching the instructor how to start that program. The SVSA, the Swami Vivekananda Yoga Anusandhan Sangstha, brought their institute to United States, and they have started the yoga university outside India, which is mentioned the Vayu Vivekananda Yoga University, and they have gone through a rigorous process in the state of California to get the university status and started the program MSc in yoga. It is extremely, extremely difficult process to get a state certification to be established as an university in United States, but Vayu has succeeded. Now they are applying for their PhD programs. Newer medical schools, this is called your Oakland University, Bowman School of Medicine. They have started the School of Yoga Therapy in their whole educational system. The Maryland University of Integrative Health, they started the Master of Science in Yoga Therapy a few years back. And interestingly, they started in 2013, so almost 10 years back. And all of their graduates gets a job right away because all the established medical centers in this country, they're hiring the trained yoga therapists. And remember one thing, normal yoga teachers training in this country in 200 hours of training, and yoga therapy is between 800,000 to 1,500 hours of training. So it's a very long, rigorous process because they need to understand the basic pathophysiology of every asanas, every pranayamas, every yoga practices. This is our friend, most of you know him by now, our Larry Payne, Loyola Marymount University, and Rubenstein. She came to your institution before Laurie. Laurie came before with all of her group. This is all of them are in the white coat, and they visit the Venice Family Clinic as a part of their yoga therapy rotation. We teach the physicians how the yoga therapy works. It's called a psychoneuroendocrinology. The relaxation response and it affects the limbic system of the brain, which is your emotional brain, amygdala, and the hippocampus. Amygdala responds to fear and hippocampus to your memory. Through neurotransmitter, it sends a signal to hypothalamus for your homeostasis, and then through neurotransmitter, it sends a signal to the pituitary gland. Through pituitary adrenal axis, it corrects your hormonal imbalance. The altered hormonal homeostasis gets corrected, which is becoming one of the true cause for a lot of functional disease for the women and the men. It also affects your autonomic nervous system. It causes a rapid shift to parasympathetic from sympathetic overdrive system. It controls epigenetics. So what it is that all the chronic diseases are from genetic mutation, but genetic mutation doesn't cause the disease. The gene has to express. Gene is expressed by epigenetics, which is basically the environment, which is basically the yoga therapy and Ayurveda. It controls the gene expression, and it also acts as an antioxidant and also controls your apoptosis. It controls your apoptosis and telomere length. So it acts like your youth. That means you don't age and you really look very young and healthy when you're practicing a dinocharya, daily practice of yoga. Better immune status, and we teach them that in pranayama, the inhalation is sympathetic and exhalation is parasympathetic. The breathing and better oxygenation does what is called aerobic glycolysis. In aerobic glycolysis, glucose combines with oxygen, forms carbon dioxide and water, and plus ATP, adenosine triphosphate, which is the energy, and the different kind of energies, catabolic, metabolic, and anabolic. We connect them to the psychophysical body type in Ayurveda, catabolic being vata, metabolic being pitta, anabolic being kapha. If you don't have enough oxygen, you get an anaerobic glycolysis, and glucose and less oxygen produce lactic acid, pyruvic acid, pain-producing substance, and make your life miserable. So the aerobic glycolysis helps in all the pain and the control of the symptoms of the chronic lifestyle-related disorders. A regular practice of yoga increases vagal tone, that means your parasympathetic activation, modulates autonomic nervous system, causes a rapid shift from sympathetic to parasympathetic activation, creates a control over autonomic nervous function, increases baroreceptor sensitivity. Like we teach them that you put your head down, put your head below your heart. When you put your head below the heart without any support, without any assistance, your intracranial pressure goes high up, intraocular pressure goes up, intracarotid pressure goes high up. But if you keep it down, slowly the neuroplasticity comes in, intracranial pressure comes down, intraocular pressure comes down, the baroreceptor sensitivity goes high up, chemoreceptor sensitivity goes down, and you feel a profound level of relaxation response, which allows you to put your head down and feet high up without any assistance, without any support. So we teach the person to go through the headstand in stages. We teach the whole headstand and the heart rate variability for a whole session for the physicians who wants to introduce yoga therapy in their practice. The heart rate variability, when there is a more variable parasympathetic activation, when the heart is stiff, it is a sympathetic activation. Even the same heart rate is low. We teach them in a primary prevention that you have the genetic mutation or genetic change for your lifestyle-related disorders from your parents. But if you are practicing a relaxation response and parasympathetic activation, you get a genetic suppression, prevents the onset of genetic disease, which we call the preventive medicine. And here it is in the Cleveland Clinic, one of the prime institutions of this country, is a 180 lifestyle program. It's a Time magazine, how not to end up here. That means in a practice of yoga therapy, it is a preventive medicine, so you don't end up in the hospital. This is their practices in the Cleveland Clinic, and this is their labyrinth they have. They're in charge of the program. It's called a Chief Wellness Officer. There is no illness anymore. It's called a wellness. In a secondary prevention, you are genetically predisposed. You did the lifestyle changes or whatever you did lifestyle created the disease. So now we had the clinical disease, you have the usual and customary therapy, but you included yoga therapy with relaxation response and parasympathetic activation. You get a genetic suppression, prevents progression and reversal of the disease. It is very common that coronary artery disease, it progresses. Or also if you have a breast cancer, the usual and customary therapy, but after a while, then cancer comes back because genetic mutation is still there. In a tertiary prevention, it prevents the complication of the disease, the complication of diabetes, diabetic nephropathy, diabetic retinopathy. Rehabilitation is very, very important. When you do a regular practice of yoga, primarily we tell them to do a daily practice. We said you take the medication daily for lifestyle-related disorders to practice daily. Better management of disease, less pharmaceutical support, and better quality of life. There's a cure for some genetically your predisposed disease, and these are the few disease examples. National Institute of Health, NIH and FDA, Food and Drug Administration, they control the whole healthcare system in America. And they have their centers called NCCIH, National Center for Complementary Integrative Health, and they help with yoga therapy. And in their website, you have yoga, what you need to know. The director is an MD physician, Helen Langeneville. She's an endocrinologist. She started her job in 2018. The whole NCCIH has a different name before and is established in 1998. And they get a good funding from NIH. And for this year, their funding is close to $170 million. The International Association of Yoga Therapists, the primary association in the United States for controlling and regulating and promoting yoga therapy. I'm with the IAYT for a long, long time. I was the president for 5 years from 2013 to 2018. And during that time, we have established the mission to yoga as a recognized and respected therapy. We have a definition, publication resources, conferences. We had a standard, certification, and accreditation. As of yesterday, we have a total individual members of 5,135. We have a certified yoga therapist. We call a certified International Association of Yoga Therapists, 3,948. And my brother, Anand Balayogi, he was the first CIAYT from India. Total member yoga therapy schools are 152, and accredited yoga therapy training program is about 69. This is the definition of International Association of Yoga Therapy. I've defined yoga therapy is the process of empowering individuals to progress towards improved health and well-being through the application of the philosophy and practice of yoga. It took few years and years to come up this definition, because as you know, in the United States, every person has opinion. 330 million people, 330 million opinion. So we have to come up with this. I want to just show you what their activities are. It was established in 1989, the International Association of Yoga Therapists by Larry Payne and Richard Miller. It publishes a journal, International Journal of Yoga Therapy, also for a practice yoga therapy today. It is the annual conferences called SYR, Symposium on Yoga Research, and Symposium on Yoga Therapy and Research. During pandemic, all the conferences were online, but now we bring it back. This is the journal, this is the practicing journal. This is one of their websites. You could see I was in the board president for a long, long time. And this is a program, Symposium on Yoga Therapy and Research, and Symposium on Yoga Therapy, which is also actually the brainchild of our Sadhbir Khalsa. Harvard Medical School, the #1 medical school in this country, also have the program in yoga therapy. The Smithsonian in Washington, D.C., the most iconic landmark in the United States is the Smithsonian. And there was a program, Yoga as a Lifestyle Medicine in Smithsonian. I was one of the presenters for that, and IAYT was the sponsor for that conference. API, the American Association Physicians of Indian Origin, they have a big Indian origin physicians in the United States. They have their own journal, and one of the journal has a special edition, Yoga Therapy Guide for the Physicians. And this is the API Yoga Therapy Clinic. They're introducing yoga therapy in their own practices. And these are a few patients. I just want to show it to you, how got improved, who come to our classes. This is Alan, who had a ejection fraction of 10 to 20%. The inoperable coronary artery disease, but the practice of yoga, asana, pranayama, meditation with a relaxation response, his ejection fraction got from 10% to 40%. Then he started doing the headstand on his own. And as I said, headstand is a profound relaxation response. And you can see with the parasympathetic activation, even the blood work gets better without any medication. This is due to baroreceptor sensitivity. Patricia had a multiple sclerosis. She was in a wheelchair with the practice. She's standing now. She put her license plate in her car called Transforming. So I translated, yoga therapy is called the art of transformation. And she has also a little bit of asthma, which got better. Span had a Parkinson's disease. With yoga therapy, he was able to stand on one foot and able to do a headstand on his own. Robert is a cardiac cripple. You name it, he had it. He had so many. He had a malignant hypertension, a surgery for VSD, surgery for descending for atrial fibrillation, congestive heart pacemaker. I mean, the cardiologist gave up on him. He was practicing your balancing poses and the mudras and daily practice. His blood work becomes almost like a teenager's blood work, and he's enjoying a good quality life. This is very interesting. This is a yoga practitioner for the whole life, and he was practicing his headstand for a long, long time. He had a cataract surgery, and the cataract surgery was done by a physician who also practices yoga, who also practices headstand. And he said, I know the basic physiology behind it. I don't want anybody to practice headstand after a cataract surgery, but since you're doing it all of your life, nothing will happen to you. Go ahead and do it. 6 weeks post-op, he's doing a headstand after his cataract surgery. This is the beauty of yoga therapy being individual for this Western medicine. She's actually in charge of the Parkinson's disease program in the Virginia Beach area, and she got better with yoga therapy. Look at the Parkinson person is doing a tree pose, brickasha. It also improves your outlook. This lady, when she came, she had a stroke, intracranial hemorrhage, and she was sitting down doing nothing. Slowly we tell them to, why don't you keep your spine straight, keep your eyes closed, do some pranayama. Slowly and slowly she get into it. Then she started putting on some nicer clothes. She started putting on some makeups on. And finally one day come with this bright clothes on her. So what happened, when you feel better, you look better. So finally, to finish my session, I always tell people, where do we learn this origin of yoga therapy? Origin of yoga therapy, you learn from the babies. All the children does yoga. Why? Because they feel better. It creates some physiological changes for which they keep on doing it. I have 2 grandbabies. I taught them. They do every yoga poses. Actually, the school also teaches them. They sit down in Vajrasana, Sukhasana. They get up into a Bhujangasana. This is Salavhasana. Adhumukha, downward facing dog, Marjarasana. Jatad Parivartanasana. Another one, Kufuvisha Konasana, we try to do it and they do it normally because this is the part of that, Paschimottanasana. So all they do is yoga poses. We try to do a balasana, but here they do it so spontaneously without any effort. Supta Baddha Konasana, that's the way they sleep. They put the foot together, they sleep, babies. We teach the people with insomnia to start sleeping with a Supta Baddha Konasana. They do a Nukasana, boat pose. So this is my last slide for you to take home. This was a slide from Chuladin Ornish. This was from Swami Satchitanand of Yogaville. He was invited in the University of Virginia with a large group of physicians to give a talk on yoga therapy. He got into the chalkboard. He wrote illness and wellness. Then he circled I and the we when he says, when you change I to we, the illness became wellness. Thank you for giving me the privilege to present to you the integration of the yoga therapy and modern healthcare system and American experience. As I said, this is a bad timing for us from United States. Your 10 in the morning or 10:30 in the morning will be our 1 o'clock, 1 a.m. So that's what I'm sending you the recording, and Anand will take care of it. And if there is any question, comments, and if you can put it in the Zoom, I'll be glad to answer for all of you. Again, thank you for giving me the privilege, and it's a good night from America.